Good evening, everyone. I would like to present some of the courses by Ayurvedamap before we start, and our faculty will join shortly. First one is Thanika Chikitsa Three Roga. It's a 3 months duration course. In this, you will learn gynecological therapies, hybrid learning with step-by-step SOPs, training tailored to real OPD cases, etc. Next one is Diploma in Ayurveda Cardiology. It's a 6 months online training program for BMS doctors. In this, you will learn key concepts in clinical cardiology, hypertension management, arrhythmias and conduction disorders, cardiac investigations, classical Ayurveda understanding, drug selection and formulations, emergency and ICU management, therapeutic approaches, etc. Next one is postgraduate diploma in sports medicine and rehabilitation. It's a 6 months intensive program designed for working BMS doctors. In this, you will learn musculoskeletal health expertise. Then there will be X-ray or MRI interpretation plus Panchakarma for musculoskeletal health conditions. And there will be hands-on training at Daysman Hospital, Kondoti. Another one is diploma in antenatal and postnatal care in Ayurveda. In this, you will learn foundational sciences, preconceptional care, antenatal management, labor and delivery, postpartum care, mental health, cosmetology, product formulation, etc. And there will be offline hands-on training, which includes bandaging techniques for Sutika, specialized postnatal massage and Abhyanga, Yoni Dhuvana, Yoni Pichu therapy, Veduguli preparation, under-eye oil preparation, breastfeeding techniques and safe baby handling, clinical assessment and dietary planning, etc. Next one is Diploma in Ayurveda Cosmetology. It's a 6 months course and offline classes will be at Bangalore. Next one is Professional Diploma in Ayurveda Panchakarma. In this, you will learn Introduction to Panchakarma, concept of Ritu Shodhana, OP level Panchakarma, Kriya Kala, Snehana, Swedana, Vamana, Virechana, Vasti, Nasya, Tekta Moksha, Karkitaka Chikitsa, Kerala seasonal treatment, drugs in Panchakarma, diseases and Panchakarma, etc. There will be Kerala Panchakarma as well. Panchakarma in Prasudi and Stri Roga, Panchakarma in Kaumari Pritya, Panchakarma in Netra Roga, Panchakarma in Manasika Roga, physical therapies, cosmetology procedures, marma bandaging, etc. And the another one is Kriti, Ayurveda product making. And there's online sessions with clinical applications will be there. You will learn to make kajal, soaps, lip balm, lipstick, face packs, face wash, moisturizer, butter, creams, lotions, gels, toners. All these are Ayurveda based. And pre-booking for PG diploma in Ayurveda cosmetology and Ayurvedic nutrition has started. The courses will start in May 2026. So our faculty has joined. Our topic is how to assess Samyak Lakshana in Panchakarma. Procedures, session 1. Session 2 will be on 28th April. So our faculty is Dr. Ramya Alakal. I would like to extend a very warm welcome to Dr. Ramya. She is the Vice Principal of Ashtanga Ayurveda Vidyapeetham, Vavanur, where she is the Associate Professor as well as the Head of the Panchakarma Department. She is running special OPD for neurodegenerative disorders. Currently, she is pursuing PhD at Kerala University of Health Sciences. Welcome, ma'am, and I welcome each and every one you to the session. Thank you.
Am I audible?
Yes, ma'am, you are very audible.
Let me share my screen.
Okay, ma'am.
I think sharing is not being enabled.
It is enabled, ma'am. Please check.
The screen is visible, right?
Yes, ma'am. Visible.
Fine. Very good evening to all. చతుర్ముఖ సమారంభం వాగ్భడాచార్య మధ్యమం అస్మదాచార్య పర్యంతం వందే గురు పరంపరాం రాగాది రోగాన్ సతతాన్ శక్తాన్ అశేషకాయ ప్రసదాన్ అశేషాన్ ఔత్సుక్య మోహారతితాన్ జగాన యో పూర్వ వైద్య నమోస్తస్మై. So yes, dear Dr. Anupa and all others. So I think we'll directly move on to our topic of today's discussion. Because so when we say Samyak Lakshana assessment, okay. So I just want, I think there are participants within us, I mean, in the discussion. So I just want, when you heard about this topic, Samyak Lakshana assessment, I just want you to type in the chat box that what do you actually expect out of the session? Or, as I'm sure all of you are practicing doctors, where are the issues that you really felt that in Samyak Lakshana assessment, you have some clarity, need more clarity, or whether it is needed or not? What are your concerns about the Samyak Lakshanas as a practicing clinician or as a beginner? I would just want you to type in the chat box so that in that background, I'll be able to discuss further. So I request all of you, because I'm sure that only when there is an interaction and we really know like what is your, because I'm not seeing you, I don't know your background, etc., etc. So for a better output, I think that will be useful. So I will definitely request each one of you to please type in the chat box. Yeah. Yeah, whether Komal has told UG final year, Mohammed had told beginner. Okay, fine. Even as a UG final year or beginner, what do you want to know?
Doctors, please post your understanding about the Samyak Lakshana of the procedures. That's what she would like to know. Dr. Ananya has posted most of the Lakshanas are not uniformly accessible in the same way in all patients.
Fine. Okay. Yeah. Very good observation. Dr. Vijay Kumar has not only Samyak Lakshana, if you tell the process of procedures, today's session is Samyak Lakshana. Okay, within this time, it will be very difficult to discuss process of the procedures. But of course, with regard to procedure, I mean Samyak Lakshana, we definitely have to be discussing procedures. There is no doubt about it. We'll definitely be covering that aspect also. Okay, yes, Dr. Vijay.
Doctors, today in today's session, we'll discuss about the Samyak Lakshana. So our prime focus will be Samyak Lakshana. Okay.
Ashlyn Varghese, how to handle complications. Okay.
Doctors, I request you to stick on to the topic, please.
In today's area of discussion is Samyak Lakshana assessment. Okay. Sonam, Dr. Sonam says, what tell us Asamyak Lakshana also so that we can differentiate. Okay, Sonam. Virajita speaks about how to practically assess Antiki, Maniki, Vagiki, Langiki in Vamana and Virechana. Fine. Okay, okay. Yes. Yes. Anyone else? I could see 40 plus participants. I think I can have better responses, more responses, whether all Lakshanas are must to be observed and how to observe them. Yeah, yeah. Very relevant point, Ananya. Anything else? How to identify Samyak Lakshana in autoimmune diseases? Dr. Bakul. Yeah, fine. Okay, fine. Samyak Lakshana, how can we correlate it with modern parameters? Okay, fine. Okay, fine. Okay. So, relation of Koshta, Agni, and Samyak Lakshana. Fine. Dr. Harshita, how to assess Lakshanas in different Prakriti patients? Yeah, fine. Yeah. Okay, okay. So, thank you for the responses. Okay. So, we'll directly move on to our topic of today's discussion. Yeah, so best wishes from Ashtangam Ayurveda Vidyapeetham, the institution where I come from. So anyone coming down in and around Palakkad, you can always uh, come and visit our campus. Okay, fine. So my contents, I have divided it into Samyak Lakshana of Snehapana. So when we speak about Snehapanam, Samyak Lakshana, it is very important for the proper Samyak Lakshana to manifest how much Snehana we give, which Snehana we give, which type of Snehapana we are doing, whether it is Shodhananga Snehapana, Shamana Snehapana, or Brahmana Snehapana. The Samyak Lakshanas that we observe in all these have to be different. Basically, it's not every Lakshana to be everything. These things we actually, Acharya gives us a guideline, and it is after our clinical observations and all that we get more and more deeper sense behind all these aspects. Actually, when Dr. Jasul talked me about fundamental principles that I would like to communicate with all other than Agni and Koshta, I always feel this is one area wherein, we as practitioners in a general practice for a GP, Okay, I don't want, like, the Samyak Lakshana assessment has to be the part of a, what you call it, as a Panchakarma specialist only. No, every Ayurveda doctor who practices, who runs his clinic, who practices Ayurveda must be aware of these specificities. So I always feel this is very important area. That is why we had spoken. So I'll be starting with Snehapanam, moving on to Svedanam, followed by Vamana and Virechana. Okay. Yeah. Now see, when we say about Samyak Lakshanam, what is Samyak? That means what is Samyak Pravarti? Okay. So when we say Samyak, that means that Samam, okay, that which leads to Samavastha, that which paves way for the ideal situation. Okay. So when I plan a Snehapanam or when I plan a Svedanam, Lakshanas that indicate that these procedures have acted in the Samyak format, in the ideal way of the body or within the system, human system, then it is called as Samyak Lakshana. So, I may do Snehapanam in Kushtam case. I may do Snehapanam in diabetes. I may do Snehapanam in PCOD. I may do Snehapanam in an Unmadam case. Okay. Vatanulomyam, Dittvagni, Snigdavarcha, Sasamhadavarcha, Snehodvega, Klama, Snigdaha, Rukshe Viparyayaha. This has been the Samyak Lakshana told in the Snehapanadhyayam Ashtangridayam. There is no special Samyak Lakshana told for Kushtadhyayam, special Samyak Lakshana told for Vadaraktam, or special Samyak Lakshana told for Unmadam, etc. So these are general guidelines, and these Lakshanas are actually the response of the individual body when we do a procedure and observe that how that body or how that individual is responding to the procedure. Okay. So how the process that I am doing, whether it is on the right way or whether there is a problem that I have to change the time of administration or dosage or medicine or the patya that he follows or whatever he thinks. So Samyak Lakshanas are body's responses as understood or as documented by acharyas. Those are the minimum lakshanas. Of course, with the disease-wise possibilities, there can be other symptoms with respect to disease's clinical presentation, which definitely is related to the samprapti. That is why Acharya has not mentioned any samyak lakshanas in the specific chikitsa prasthanam. Okay, so let us first discuss snehanam. Okay, samyak snigdha lakshanas. Okay, as you all know. Okay. Now see, for in the context of snehana, as you all know, snehapanam is with an idea that you are all like practicing physicians, that we are actually working on, already existing platform. Snehana is a process of, wherein we give internal medications. 1 second. Yeah. So when we think about snehana, we do go for snehapanam. Are the slides visible?
Yes, ma'am, visible.
Okay, fine. So when we are thinking about snehanam as such, so when we are discussing or thinking about Snehapanam, there are particular specific things that we have to be thinking. First of all, whether the patient is primarily indicated for a Snehana. Second thing, if at all he is indicated for Snehana, what is the Snehana that whether he needs a Shodhana, then our dosage must be for Shodhananga Snehapana. If he needs a Shamana, our dosage must be for Shamana. And if he needs Brahmana, our dosage has to be with respect to that. But however, Acharya has given for a particular individual, if we plan for a major Uttama Matra, that is that dose that gets digested within 8 yamas. If it is Madhyama Matra, that digests in 4 yamas. Dvabhyam Chaturbhihi Ashtabhihi Yamaihi Jiryanti Yaha Kramat Hrasva Madhyotamaha. That has been told actually. So see, if for me, Ksheerabala Tailam 20 ml gets digested in 4 hours, it's almost Hrasva Matra for me. At the same time, for if Dr. Anupa Ksheerabala Tailam gets digested, 20 ml of Ksheerabala Tailam gets digested in 10 hours, then her Hrasva Matra alla, her Madhyama Matra is 20 ml. That is why individual to individual, depending upon the Bheshaja also, the ultimately the dosage of Snehana has been told it to be the so-called with respect to time taken for digestion. But when we, in all Brihatrayi, Ashtanga Hridayam, Charakam, Susrutam. But of course, when we go through later text like Ashtam and Sharangadhara Samhita, Chakradatta and all, you could see Acharyas quantifying the Snehapanas dose like Pala in terms of Pala. But of course, with respect to principles, it is the digested quantity, which can vary from individual to individual, and there can be other influential factors like Rutu Vedhena, like the present patient sattva at that particular time, and other the kind of the person who is already with lot of history of somebody from Rajasthan who is having a habit of having lot of ghee, then we again start a little dose may not be okay for him. His satmata is different. So there are many factors that we have to be working on. So as you all know, Achapaya and Vicharana are the two formats of Snehapanam. So whether it is for Achapaya, again we have Shodhananga Snehapanam and Shamana Snehapanam. And Brahmana Snehapanam definitely comes under Achapaya because Brahmana has to be given with some kind of food and all. And Vicharana Sneha is like other than adding with food along with preparation of Sneha, Odana, Vilepi, etc. Other procedures like Nasya, Abhyanga, Vasti, etc. also come under Vicharana Sneha. Why I am telling it now here is because there are now work going on wherein, without oral intake, Matra Vasti, can we see Samyak Snigdha Lakshanas? Okay. Other forms of Vicharana Sneha can, if somebody is reluctant to have ghee from mouth, can we give it via anal route so that he presents with Samyak Lakshana in the same way that we will discuss. So that is the thing. Okay. So, yeah. So I would like you to just comment. I'll be just sharing 3 cases over here. Okay. Now, I want you to just comment your understanding about these cases, whether you would go for a Snehapanam in this case. If you plan for a Snehapanam in this case, I want you to just tell with what Grita and probably which type of Snehapana, whether Shodhana, Shamana or Brahmana, what will be your plan. Okay. So 45-year-old male, his height is 160 centimeter, his weight is 78 kg, and who is known cause of psoriasis for more than 10 years. Now he had now presently presented with increased itching and scaling all over the body, especially in the scalp after having continuous non-vegetarian food. His Agni is presently Mandam, Koshtam is Madhyama. Okay, so discuss the possibility of Snehapanam. You need not detail that, that is not under our pari. Just tell me if you go for a Snehapanam, what kind of Snehapanam or what Grita. Could you please, yeah, you can see all the 3 cases and then you can chat your answer. Case 2 is, a 36-year-old female patient, 150 centimeter height and 70 kg weight. Recently diagnosed case of hypothyroidism with a TSH. Agni is Vishamam, Koshtam is Kruram. Had come to visit you in your clinic, discuss the possibility of Snehapanam and derive the protocol. Don't write the protocol. Snehapanam, which type of Snehapanam if you choose. That is case 2. Case 3, 25-year-old IT professional with irregular food habits, late night schedules, etc. developed Amlodgaram Koshtadaham for last 1 week, especially in the early mornings. Discuss possibility of Snehapanam. These are the 3 cases. So could you please type on the chat box if you go with Snehapanam, case 1, 2, 3.
Doctors, you can post your answers like case 1, this procedure or this Sneha, case 2, case 3, like that. Dr. Nikhila has posted Mahatiktaga Krida for case 1. Dr. Tabasam has posted the same. Mahatikta Gridam only. Doctor, please mention which case you are referring to.
You can just tell case 1, case 2, case 3. So case 1 is this, case 2, case 3.
Kamya Pillai has written Shodhananga Snehapana with the Aragoda Mahatikta Kritam, case 1. Tabasam in case of psoriasis, Snehapana with Mahatikta Kritam. So, first one, case 1. Dr. Sonam Panchatikta Kritam, in which case Dr. Sonam Nidhi Kumari has posted Shodhana Snehapana Mahatikta Kritam for or Panchatikta Krida. Kindly mention the case 2. iPhone, somebody with the name iPhone, we are not sure about the doctor's name, has posted case 1, Arabuda Mahatikta Kridam. In case of psoriasis, Dr. Sattabasam has posted Indukanta Kridam. Case 3, Dadimadi Kridam, Shamana Snehabanam, by Dr. Kartiga. Thansira Rahman, case 1, Tiktaka Krida Shodakarta. Case 1, Panchatikta Grida by Dr. Sonan Tiwari. Nidhi Kumari Shodhan Snehvana Varanadi Grida or Dhanyaga Shundi Grida. Case 3, Induganda Grida by Dhansira. Thank you for posting all these answers, doctors. Case 2, Varanadi Grida by Dr. Nikhila. Case 1, Mahatikta Gridam by Realme.
Case 2 is Triphala Gridam. Okay.
Dr. Sonam is requesting ma'am to change the slide for 2. She's asking to show the case 2. Yes.
Yeah, case 2.
Hypothyroidism, 36 years old female patient, 70 kg weight, recently diagnosed case of hypothyroidism with TSH 10, Agni Vishamam, Koshtam, Kruram. Case 2, Gugulu Tikta Gridam by Dr. Tabsum.
Fine. Okay. So, yeah. So, anyway, I'm not discussing the points of Mahatiktagam. Aragoda Mahatiktagam was a good choice because there was Kandu and Shodhananga Snehapanam for the first case was the first thing because he is having Kushtam. Kushtam has to be treated, repeated Kushtam. So, has to be treated with Viraj, I mean, Shodhana, Vamana or Virajana. For that, usually Mahatiktagam we don't choose because Mahatiktagam has Amalaki Swarasa a lot and Mahatiktagam is a Rasayana. So, for Shodhananga Snehapanam, you can go for Aragoda Mahatiktagam or Tiktagam and followed by Shamana and Rasayana Mahatiktagam. That is the usual clinical practice that we follow. Okay, and Panchatiktagam is also a choice in the first case. In the second case, I think some had told Trufala, many had not commented upon it. And the third case, somebody has told Tiktagam, then something else, right? Yeah. So in the first and second case, definitely we have to be planning for Shodhana. Okay, see, 36-year-old, 150 centimeter height and 70 kg weight. She's overweight, right? With hypothyroidism. So there is a Agnimandim in the background with Amam in the Samprapti. So definitely we have to be planning for a Shodhanam, of course, after needed Deepanapachana with proper Agni. And in the last case, actually, what is more important, and we have to go for a Shamana Snehapanam. Shodhanam is not needed. Last 1 week only he had presented for the clinical case. So last 1 week means dosha dushti is not much more, and you could see it said especially in the morning. So Shamana Snehapanam has to be done in the case 3. So that has to be our idea when a case come to us. Primarily, which type of Snehapanam should we make him undergo? So naturally, when we come to a clinical backup, what are our variables is when to do the procedure, how long to do the procedure, how much to do the procedure and all. Okay. Yeah. So I think there is I'll just switch off my video and then I'll be talking. Some connection issues. It's raining here. So 1 second. Yeah. So see our next variable. So our next variable, things would be how much we have to be doing, the matra that has to be selected in the case. So for Samyak Lakshana to appear, most important is according to the clinical condition, how much medication has to be given, how much grida or snehana has to be happening. That is very important. Okay. So that, as I mentioned, Ashtanga Hridaya says, Uttama Matra is needed for Shodhana, Madhyama Matra for Shamana, and Hrisva Matra for Brahmana. So, Shodhananga Snehapana, Uttama Matra need not be there for all conditions. Okay, Madhyama Matra need not be there for Shamana. You can do Shamana even with Hrisva Matra if the condition is not very chronic and the Bala of the patient is slow and all. This guidance actually gives us an idea about guidelines by Charaka gives us an idea about what Charaka's guidelines gives us an idea that Uttama Matra Snehapana has to be given for Prabhuta Snehanitya Kshutpipasa Saha Uttama Sharira Agnibala and in diseases like Gulma Unmada Sarpadamshtra. In Madhyama Snehapana Matra like Madhyama Sharira, Madhyama Balarogi, etc. Madhyama Snehapana has to be given, especially in conditions like Arushka, Spota, Pidaga, Kandu, Pama, Kushta, Vadragta spectrum. And Hrisva Snehapana can be given with respect to Vriddha, Bala, Mandagni, Avarabala, Jvara, Adisara, Kasa. So there has to be 2 criteria to decide the dosage when a patient approaches us. What is his Agni and his Bala, the physiological parameters, and the disease that he has, which gives us an idea about the Samprapti. So these 2 has to be, for example, a Vadarakta Rogi is having Avarabala, then he has to be going for Avarabala Hrisva Matra only. Okay. Now at the same time, if a Kandu or Kushta case has got Uttama Agni, then definitely we have to be going for an Uttama Matra Snehapana in the patient. Okay. So both physiological factors as well as disease factors have to be considered. That is why Acharya gives us the dead guideline. And when we go through Susruda's guideline with respect to the dosage of Snehapana, Yamatra Parijiryate Chaturbhagakate Ahni, like what Ahni in 12 hours, when first 1/4 part is gone. First after 3 hours, what dosage is given, digested, it is called Deepati Agni Malpa Doshe. When Ardha Divase in 6 hours, it is Brahmani Madhya Doshe. Then when it is digested in 9 hours, Yamatra Parijiryate Chadurbhaga Avasheshite Snehaniya Sacha Matra Bahu Doshecha Pujita. And then it is Aparinate Ahani, 12 hours, Glani Madamurcha, Asamurcha Pujita, that has been given. So there also, how many hours the patient takes for digestion and a specific clinical action is also told, which guides us to understand these things. So that is why Pratama Matra 3 hours, Agni Deepti and Alpadosha Susruta gives us. Dvitiya Matra 6 hours is Vrishya, 9 hours is Brahmana, 12 hours is Snehaniya. So this must give us an idea that if the patient's Agni is in a low dose and we need Agni Dipti in the background for any cause, most important is definitely we have to go for a 3 hours digested dose only in that case. If the patient, we need to make him undergo a Shodhana, it can be, a Madhyama Matra thing, somewhere between 9 to 12 hours digestion. If the patient is having diseases like Unmada, etc., and if the patient is a regular exercise or his Agni is very, very high on Tikshna Agni, or he is a very physically active person, in such cases and all, then we have to go for an Uttama Matra. So that is the guideline for Matra. So only when we decide Matra, we will be able to observe Samyak Lakshana in the patient. Okay, so Delhana says that dosage of Snehapana has to be calculated with respect to Purusha Bala, Dosha Bala, and Amaya Bala. So three things we have to consider. The same thing as mentioned by Charaka, the Agni Bala, etc., which is Purusha Bala, the Amaya Bala, and in that also both of them, somebody has both the patients have Vadraktam. But if the Dosha Bala of Vadrakta in first case is this much, and if the dosha bala in the second case is not much, like for example the third case, there's just 1 week history, the dosha bala may not be much high, so shamana would be enough. But if the same thing would have been for a very longer period and on and off amlodgaram, etc., then definitely we have to be going for a what do you call it as on a higher dose. So this understanding we must always have in the backup. So that is why Dalhana says yata balamiti dosha purushamayana हीनमद्य उत्तम बलमाश्रित्य यामद्वय चतुर्थयाम सकलाः परिणामं सापेक्षिणी मात्रा. So matra has to be always be apekshini, and it depends upon yata balam iti, which balam dosha purusha amaya balam. Okay, so this is our clinical conclusion about. So in the first case, I would definitely choose for a Snehapanam with his Agni and all. I would choose for a Madhyama Matra Shodhananga Snehapanam. In the second case also, I would choose for a Snehapanam. But since her Agni is Manda and all, I may not go for a Madhyama Matra Snehapana. I would choose for a Hrisva Matra Shodhananga Snehapanam in the second case. In the third case, since he has symptoms only in the recent time, I would plan for a Shamana Snehapana. But since he has recent things, recent history, of course, he is having irregular bowel habits and all, food habits and other things, then I would choose for a Hrisva Matra Shamana Snehapana in the third case. Okay, hope that is clear. Okay, so in that background, when I do, let us think about the determinants to decide the dosage of Snehapana would be Agnibala, the Koshta, Vaya, and Kala Sattva. Okay. Kala is also a factor. Like Ushna Kala, too much of Snehapana may not be a choice. Sattva, in our Sattva, higher dose will be again bringing up issues. These things. Okay. So always Snehapana has to be started with the Hrisyati Matra, because directly to one single dosage is not expected in Shodhananga Snehapana, because we have to bring in Utkleshna. But in disease conditions like Sarpadamshra and all, where Acharya has told Uttama Matra Snehapana, we must understand that it is not that you start with a small dose and take days. It is, those conditions are where it is like emergency management. You take high dose here and all, where traditional snake bite is practiced traditionally. Actually, there almost 300, 400, there are special Trifaladi Gridam and all. 300 ml of Gridam is given in a single dose when a snake bite patient comes to them actually. There are actually Vishachikitsas in Kerala. So whenever we have interacted with them, how they practice and all, this was the method. Of course, it is not much in Prachura practice now presently. They generally everyone approach an antivenom, I mean modern hospital with antivenom, but there are places still they who are practicing. And in their erstwhile earlier when they were practicing, it was all a big Uttama Matra Snehana that they give in a single dose so that the Visha does not spread in the body. Okay. So this Hrishiyasi Snehapana and all is like, when we are planning for a starting with Hrishiyasi, when we are planning for a Shodhananga Snehapanam, because we want to bring in a Utkleshna consciously, then do Svedana, bring the dosha to the koshta, and then remove it from the nearest point. Okay. So very specifically, Acharya gives us an idea that you have to, if you are planning for a Madhyama Matra, you start with Hrisyasi, then move to Hrisva, then to Madhyama. Continue Madhyama Matra till the whole spectrum of Samyak Lakshana observes or Samyak Lakshana manifest in the patient. Yeah. So see, in all spectrum, in all the cases when, it has been given, this is a specificity from Aruna Datta, Hrisva Madhyotama iti nirdeshe vyaptaha, Hrisva matra yamadvaya, then from tato Hrisvam, tato Madhyamam, tatah uttamam cha prakalpayet. You could see. Vikshe akalpya prak purvameva ajnata koshte purushe uttama matra vishe purvam hrisiyasim kalpayet. ततः ह्रस्वं ततो मध्यमं ततः उत्तमां च प्रकल्पयेत्. So you have to be very if you are not very sure about how the koshta responds and all, it is always good that you start with Hrisiyasi, then you move on to Hrisvam, then you move on to then Madhyamam, then continue Madhyama Matra till Samyak Lakshana it is there. See, evam Madhyama Matraha Vishe Hrisiyasim Hrisva Matra Vishe api Hrisiyasim Prak Kalpayet अन्यथा प्रत्यवाकर्तं स्यात् एवकारो अवधारणे तु शब्दः यदः उत्तरमिति क्रमनिर्देशार्थम्. In Ashtanga Hridaya shloka, you could see prageva tu hrisayasim. That word is coming in that shloka. That tu indicates uttarottaram kramanirdeshartham, it seems. Okay, so you have to start always Snehapana with prak hrisayasim, small dose. Observe how the patient responds, bring in Utkleshna in the body, and then continue it. That is the thing. So when in that context, when we are actually doing Snehapanam, Hrisiyasi to Hrisvamatra and all, what is our Lakshana or Samyak Snigdha Lakshana? Let us come to our point. Okay. Samyak Snigdha Lakshana from Susruta says, Susnigdaha Tvak, Vit Shaitilyam, Deeptaha Agnihi, Mrudugatrata, Glanihi Laghavam, Angana, Adasthad Sneha Darshanam, Samyak Snigdha Silingani, Snehodvegaha Tatevacha. Ashtanga Hridayam Shloka says, Vatanulomeam Deepto Agni Varchasnigdam Asamhatam Mardavam Snigdhadam Change Snigdhanam Upajayate. That is Charaka Slokam. Ashtanga Hridaya says, Klamaha Snehodvegaha. That has been told. Okay. Now when we say this, Susnigdhata Tvakvit Shaitilyam Deepto Agnihi Mrudugatrada etc. See, when we start a Shodhananga Snehapana, you could see Tvak is Snigdha Bhava on the second or third day. Which Shaitilyam happens on the second or third day. Now we were having a Snehapanam going on with the Prameha Shavarogi. Today was his Virechanam. I had done Snehapanam with Tiktaka Kritam. He was 44-year-old with diabetes, already on allopathic medications for last 2 to 3 years. So we had reduced the dose and now we have put him for a Shodhana. So I think 4 days Snehapanam was had taken, and on the second day and all he had developed rashes in the skin. I could observe there was lot of Pittotklesha in the background, and then after stopping Snehapana, then we had done Abhyangam with Panchavalkadi Keram, and then 2 days, then Virechana today. So that was there in the so Virechana, he had almost 14 Vegas. So first day you must always understand that all Lakshanas will not be manifesting on the first day. Every day as we move on, the Lakshanas happen one by one by one. So there are some Lakshanas that help us to understand that yes, our moving is correct. Lakshanas like Vatanulomam and Deepto Agni are two such Lakshanas that every day the patient must be having Vatanulomium and Deepto Agni, because one day we start a Snehapanam, on the next day we give 30 ml. Next day, 30 ml first day gets digested in 3 hours. Next day, I plan for 65 ml. 65 ml will get digested in 3, not 4, 6 hours, but in 4 hours, because Agni Dipti already happens basically. So every day, Vatanulomanam and Deepto Agni happens. But when we see the Varchas quality, Snigdha Varchas, Asamhata Varchas. So Snigdha Varchas is Snigdha. The motion is, the feces is little oil. But Asamhata is next stage, wherein the motion has become almost loose in the background. Okay, the motion itself is very loose. And then Susrutas Lakshana, Adastad Sneha Darshanam. The next stage is you could see only ghee coming out of the rectum. I mean, when they are passing only ghee or only sneha coming out. So when we say as we continue the snehapana, the initial lakshanas are observed in the initial days, and as things continue, complete manifestation of the lakshanas happen. So there was actually an observation of 100 cases, and there was a discussion of what has to be I mean, how we understand that this is the lakshana to stop Snehapanam and Shodhananga Snehapanam. And this is the Lakshana that we can continue in those cases. That was actually a discussion wherein among all MD scholars, PG scholars, Panchakarma specialists in Kerala, and we had done a cortical declaration kind of things wherein, major symptoms like Snehodvegam, Klamam, and Adastha, the Sneha Darshanam happens. Then basically, Snehapana can be stopped. Vatanulomium, Deepto Agni and all has to be observed on a daily basis. If the person does not have Vatanulomanam on the first, second day, then we must say our dosage is not on the right path. Agni Deepti, the patient must be having good appetite. His Agni must going on to be increasing, because otherwise the patient may not be experiencing, or patient may not be having further capacity to digest. So for Shodhananga Snehapana, when the patient says Snehodvegam, I cannot eat ghee further, doctor. Klamam is in a way that he is unable to get up from his bed. Adasthada Sneha Darshanam. From Snigdhavarchas to Asamhadavarchas to Adasthada Sneha Darshanam when it happens. So see, on the third or fourth day, I give the patient 140 ml of ghee. It got done at morning 7 o'clock. It got digested by evening 6 p.m. for example. So that is 11 hours, and I have reached the Madhyama Matra on the fourth day. Then I continue Madhyama Matra with a little increase, like 140, 11 hours, maybe 160 or 165 on the next day. Till, on the fourth day, probably he might have observed, passed Asamhata Varchas or Snigdha Varchas. But then on the next day, he will be having Snehodvega. On the second day or third day, Klamam will be little. He'll be able to do his activity and all. But you again Snehapanam continue Snehapanam on the fifth day, Klamam will be in a way that he is not able to get up at all. So Klamam's degree also increases. In that way, when we are planning a Shodhananga Snehapanam, the complete manifestation of the things happen, then only we will be able to stop the Shodhananga Snehapanam in Samyak Lakshana of Shodhananga Snehapanam. Okay, so see here, when we say, that's it. Ruksha Lakshanas like Purisham Gratitam Ruksham Kritsradannam Vipachyate. So when we are actually doing Snehapana, if the patient says my Purisham is now Gratitam, it has not like Asamhata or Snigdha Varchas, it is formed and it is like pellet, like round things are just coming up. This happens usually with the Thaila Snehapanam sometimes. That means, you are not moving at all with the correct dosage. From Purisham Gratitam Ruksham Kritsrad Annam Vipachyate. His digestion is taking longer time. That means his Agni is getting haunted and you are not on the right way. Okay. Uro Vidahyate Vayuhu Koshta Dupari Davati Durvarnaha Durbalasteva Ruksho Bhavati Manavaha. That the patient becomes Durbala, Durvarna and all. That happens during Rukshana processes. But anyway, when we are planning Snehapana also, Purisha Graditatam and this Adnam Vipachanam, if it takes for a longer period, it indicates our Snehapana is on the not on the right day. Clear? Yeah. So Atisnigdha Lakshana generally Purisha Atipravarti, and then Pandutam Gauravam Jadyam. Usually Jadyam is one of the common thing. generally we don't go for that. Atisnigdha, the Samyak Snigdha Lakshana only will be because the patient will be from Klamam, the patient feels Tandra. So what's the difference between Klamam and Tandra is Klamam is physical weakness. You just feel don't do want to do like anything. But Tandra is like physical and mental weakness. You are completely off. There is Aruchi in the background, there is Pandutvam and severe Gauravam, that is that Laghutvam will not be there. Before you, during my UG days, I always used to feel, what is this when the patient is having this much of what you call it as ghee, how the patient will be feeling Laghutvam, Patanilome, Magnidipti, how the patient will be feeling so such. But you just ask the patients, even when they are on 220 ml of ghee intake on the fifth day of Snehapana, afternoon or evening, you ask for doctor for after so many years, I feel so light in the body. This is the thing that they say. This feeling they do not have, and it becomes more and more gaurava in the background. Then that means it is moving on towards atisnigdhatvam, which can be a vyapath. Okay, so that is about Shodhananga Snehapanam when we are speaking about it. So as I mentioned, when we are whether to select a Ghritam or a Thailam depends upon the doshic status. Ghritam is Pitta Nilaharam, Marutagnam Nachashleshmavardhanam, Balavardhanam is Thailam. So more of Vata Pitta in the background, Ghritam has to be selected. More of Kapha in the background, then Thaila has to be selected. So this understanding, Vata plus Kapha is Thaila, Vata plus Pitta is Ghritam. This basic understanding must be there in the background. Okay, fine. So now when one more important thing when we are thinking about Samyak Snigdha Lakshanas, I believe is basically with respect to the Rutu, that is very important. I'll share an experience which I always say, wherein, I had done a Gugulu Tiktaga Snehapanam for a Vadrakta Rogi, but, unfortunately on the third day, she developed a severe she was a female patient and she developed a severe UTI fever actually. Okay, so she had never communicated to me that she was having burning micturition and all. Third day evening she had fever. By evening afternoon she was tired, so I thought that tiredness is because of the clamam, but by evening she had fever and she told us that she was having burning micturition, her urine was red in color and all. That means, then I could understand actually during Snehapana there is decreased water intake, and that too for a female who is already Ushna. I had given a Guglu Tiktaka Gridam which is Ushna, and that too in May. Okay, so usually April, May, which are hot in the background, the Gritas has to be given in the evenings basically. So the selection was not correct at that time, even though the disease was indicated for Gugulu Tiktaga, the Rutu was not favorable in that case. Okay, so that is why if I am planning for such a thing, then I have to think of a Shamanam and all, or a Shodhanangam in the evening kind of spectrum. Usually Shodhananga Snehapanam is done only in the morning time because Susruta says Snehapana has to be given when the sun rises in the morning and all, and it is told Hyastane Jirne Eva Anne, time of administration of Shodhananga Snehapanam is after the digestion of the previous day meal that has been specifically told. So Vata Pittadiko Ratro Ushne Chapi Pibe Naraha Shleshmadiko Divashite Pibecha Amalabhaskare. This line we always have to be keeping in mind. When Pittanubandhatam is there, our Snehapana has to be, especially when we are planning a Shamana or Brahmana, it can be in the night, and when Kafanubandhatam is there, it has to be in the morning. Okay. The physiological parameter of Snehapana, as I mentioned, no, Pibet Samshamanam Sneham Annagale Prakamshitaha Shuddhartyam Punaha Ahare Naishe Jirne Pibenaraha. That is why Naishe Jirne, Shodhananga Snehapanam has to be given when the Nisha, night food is digested. That is why we always give Shodhananga Snehapanam in the morning hours. Okay. Samshamanam Sneham Annakale Prakamshita. Samshamanam has to be given when the patient has got appetite. So when Pittanubandhatvam Samshamanam has to be done, we go for Snehapanam in the evening. And when Kafanubandha background is there and we are planning a Samshamanam, we go in the morning. Okay. So in the evening, Samshamanam is we go Kanyi, in Malayalam we call Peya. We give Peya by 5:36 in the evening. And when the patient feels appetite by 8:39, then we give Grita. Okay, in Pittanubandha cases, Shamana Snehapana. Okay, so otherwise for Shodhana, Nishijirneda, the night's food has to be digested in the morning, but at the same time, no appetite shouldn't be there. That state is the state wherein we have to going for Shodhana Snehapana. So when I plan, means at the end of Shodhananga Snehapana Samyak Lakshana, as I mentioned, when we speak about these Lakshanas, the dosage of ghee that we are giving, when we are giving, how much we are giving, okay, that is very important in manifestation of the Samyak Lakshana in the full pattern. If we are not observing the Samyak Lakshana of Klama, Snehodvega, when we are planning a Shodhananga Snehapana within a period of 4 to 5 days, then we definitely have to be having idea that our Shodhananga Snehapana's dosage is not on the right take. I have to change the thing. Okay. From Shodhananga Snehapana, we will move on to Shamana Snehapana. See, in Shamana, when we are supposed to give during the time of appetite without food. Shuddhvatvananno madhyamatraha cha shaside pibet samshamanam sneham annagale prakamshitaha. Now, what is the Samyak Lakshana of Shamana Snehapana? Shamana Snehapana, how much should be given as per earlier decision? Okay, as I mentioned, the Agni is very high, we can go for Uttamatra, which is not commonly done. We generally go for Shamana in Hrisva Matra or Madhyama Matra in certain cases. Okay. So, when has to be given? When the patient feels appetite, when his complete food is digested, at the same time when the patient feels appetite. Now, what is the Samyak Lakshana end point of Shamana Snehapana? It is still the Shamana of the disease. Okay, so when we think about the Samyak Snigdha Lakshanas told in the previous Lakshana, Snigdha Varchas, Asamhata Varchas, Snehodvega, Klama, etc. by Ashtanga Hridaya, that indicates, it's Shodhananga Snehapana only. Okay. For Shamana Snehapana, Susnigdhatva, Vitshaityam, Deeptyor Agni, Mrudugatrata, Glani Laghavam, Angana, Adastada Sneha Darshanam, Samyak Snigdasya Lakshana, Snehodvegaha Tataivacha. These are for Shodhananga Snehapana Lakshanas only. Okay, for Shamana Snehapana, the Lakshana is till the Shamana of the Sneha disease occurs. In that context, as I mentioned, in clinical observation, Vatanulomyam, Deepta Agni always has to be a part of all Shodhana, all Snehapanam. Every day he must have Vatanulomanam and Agni Deepti along with the Shamana of the disease must happen. Now, when we say that, do you think Snigdha Varchas or Asamhada Varchas has to be there in Shamana Snehapana? Usually, Snigdha Varchas can be a possibility in Shamana Snehapana, but it should not be moving on to Asamhata Varchas or Adastada Sneha Darshanam, which are actually Lakshanas of Utkleshana in the body. Okay, so that should not be there. That is why we say generally during Shamana Snehapana, there is no rukshata in the koshta. Patient passes motion in a soft way, snigdha way only. But there is no other lakshanas of klama and all should not be happening because in Utkleshna Snehapana we are giving snehana during Hestane Jirne Evanne. But in Shamana Snehapana we are giving snehana when the patient is having appetite. So definitely there will be a physiological difference in the thing that happens in the body. Okay. So, as I mentioned, how long till the disease substance? So, Shavar Samana Snehapana, the end point is attainment of Samyak Snigdha Lakshana with Vatanulomyam and Deeptagni and subsiding of the disease condition. If you are giving it for ulcer, Amlodgaram, Amlapitham, till Amlodgaram comes off. If we are planning for a low back ache, Shamana Snehapanam, till the low back ache subsides. If we are planning for a knee joint pain, till the knee joint pain subsides. Here also you start with Risiasi, reach the target dose and continue the dosage till the disease completely subsides. That is our Shamana Snehapana Samyak Lakshana. Now in case of Brahmana Snehapana, we know Brahmana Rasamadya Desa Bhaktaha Alpaha Hita Sacha. Basically, Brahmana Snehapana is given with some dietary materials and Brahmana is basically given with respect to Pushti. Okay, so Alpamatra dosage, even less than Hrishiyasi Matra, that is told by Sridasa Pandita. As we told, it is a Vicharana Snehapana. But the fact remains here is, this Prayogam of Brahmana Snehapana as Prag Bhaktam, Madhyama Bhaktam, and Adho Bhaktam is clinically very effective. Prag Bhaktam for Adho Rogas, Madhya Bhaktam for Madhyama Rogas, and Adho Bhaktam for Urdhva Rogas. I'll just tell you an clinical experience which I always share. When I was doing that was first instance when I really felt the relevance of timing of giving the snehana. There was a young male admitted to the hospital with paraplegia. He was a military officer. In some operation, he had a spinal cord injury and he was having paraplegia. He was admitted and it had a history of almost 3 years. So we had actually planned for Vidaryadi Ghritam. Okay, so what we had given Vidaryadi Ghritam early in the morning. And we had it started some internal medication. So we had an opinion from Dr. Vasudevan Nambudiri sir, who was at Trivandrum College principal, and he had retired and he was DME and all. So Nambudiri sir, we just take his advice for these cases and all. Then he told, since he has got adho problems, like means he's paraplegic with respect to both legs, weakness is there. No, you give the Grita at Prag Bhakta. Like when if he's having lunch at 12:30, you give ghee at 12:15 and then you go for having lunch. Like that you plan. Don't give for empty stomach this thing in the morning. Why are you doing that? So that was our understanding was annado vigude apane. Okay. Samane madhyeshate. That is there, no? Aushada kala. But then sir told, this is snehana. You have to consider it as brahmana snehapana. Aushada Kala can be given for other Kashaya Kalpana, etc. So we had started giving Vidaryadi Grida just before lunch, basically. And within 7 to 8 days, he started improving in terms of, he's communicated one Lakshanas that he communicated with our colleague that he never had erection before, but after this 7 days Snehapanas, 8 days and all, he started experiencing erection. Okay, so erection indicates there is some neurological improvement in his thing, and he started experiencing some shock-like sensations in the legs, and he started having the sense of what you call it as touch sensation little by little. So see, only by changing this Prag Bhaktam Snehapanam from early morning Snehapanam that had a change or response in the body. That is why this Brahmana Snehapanam, Prag Bhaktam, Madhya Bhaktam, Adho Bhaktam is relevant. Recently, I had a case of, a male patient having achalasia, and then he was having actually stenosis at the stenosis at the junction, esophageal pyloric junction. And then he was suggested, he was having chronic ulcer for a long period of time, untimely food. He was rearing lot many cows in his house. And they got some disease and they died, it seems. After that, he was mentally disturbed, and that had actually aggravated. Suddenly, he started experiencing vomiting, not able to have food and all. Then he went to an allopathy. They had done endoscopy and they had told there is a stricture and then you have to undergo surgery. He had come to us. Now, in that case, I started with Pravala Bhasmam, Guducheri, Panajalam. And as he improved in his symptom, then I had introduced this Madhya Bhakta Snehapana. Tiktaga Gradam, I told you start having Kanyi Peya. After 5 to 8 spoon of Peya, you have 1 spoon of Tiktaga Gradam and then again you have Peya. Started practicing in that way, he started improving in his appetite. Now he was never able to have dosa, idli and all. He was able to have only what do you call it as liquid diet at that time. But once I started Madhya Bhakta Snehapanam, he started to have food, idli, dosa and all he was able to have, and he is able to have a normal life now. That was one Snehapana Brahmana. There I had given it as Brahmana Snehapana only because he was very Vata plus was there. He was very Sattva was avara. So CSE Matra I started. I think up to 10 ml only I had given in that case, and I had observed this response in that case. Okay, even below CSE Matra, I had started with 10 ml, then I continued 15 ml until 20 ml I had asked him to have in the same format. So that is why in that case my target again was Brahmanam. That means Dhatu Pushti. He is able to do his normal activities and his body attains normal Dhatu Parinama. That has to be our target. Now, when it comes to Sadhya Sneha, Samyak Lakshana of Sadhya Sneha we give, wherein already there is Utklishna in the body. So we just give to maintain that Utklishta Bhava in the body only. There, we could again see Vatanilomanam and Deeptagni has to be there. Along with that, Snigdha Varchas and Asamhata Varchas. Asamhata and Snigdha Varchas are two categories that can understand ki yes, some Sadhya Snehana is happening and we can go for a Virechana or Vamana as we plan. This usually is seen during Vasantika Vamanam that we practice. Okay, fine. The next one is Avapidaka Snehapanam. I don't know how many of you practice Avapidaka Snehapanam. Avapidaka Snehapanam is, the Snehapanam which is given in two dosage forms. These are actually very effective in Mutra Kritsrati Roga. We practice Avapidaka Snehapanam in neurogenic bladder and BPH, Vastyamendaka Gridam and benign prostatic hyperplasia and all. There also we are practicing Avapidaka Snehapanam as a Shamana modality only till the disease subside. And I know, I have seen a case wherein, again a fall from a tree, that paraplegia we had given, and he was not having control, sphincter control, and there he always used to use condom catheter for evacuation. And we had done almost this Avapidaka Snehapanam like Prag Bhaktam 10 to 15 ml Ghritam, and then have Paya. Then when he feels appetite, and the next dosage of 30 ml, like that we had continued with small dosage for a period of time, almost 42 days. By the end of 23 days he started feeling that feeling urge, and then he used to feel that bladder filling thing. Then he used to use catheter, and then slowly his urination improved. And then, if he just strain, he start to urinate and all. So it is not like in Avapidaka Snehapana with this chronic disease, chronic history of paraplegia wherein Mahamarma and all are involved. We just should not be just doing things for just 10 days or 12 days or 13 days like that. No, in such cases, we have to plan for 40 days, 45 days and all. That has to be our plan to just observe some response in the case. There also, we will be observing the Lakshanas of subsidence of improvement in his symptoms, for which we are actually doing our Pidaka Snehapanam. Okay. Now from Snehapanam, we will move on to Svedana. Okay. Now Svedana, see, we have many types of Sveda, right? So Drava Svedam, Pinda Svedam, Shastri Pinda Svedam, Kaya Singha in Pinda Svedam, Ruksha Pinda Svedam, Snigdha Pinda Svedam, Pata Svedam. So those are many kind of Svedas. Whatever Sveda, definitely that is another area of discussion to think about which Sveda to be done in which condition and all. Now we will come down to when we are doing a Sveda in a patient, what is more important is how to assess the Lakshanas, Samyak Spinna Lakshanas. Okay. Now when I say, Samyak Spinna Lakshanas, there has to be some Lakshanas in whatever Lakshanas that we are saying. There has to be some Lakshanas that we observe immediately after the procedure, and when the procedure has to be stopped on the same day, and how long the procedure has to be done. Like today, should I go for Svedana for 30 minutes, 40 minutes, or 50 minutes? And then should I go for Svedana for 3 days, 10 days, or 12 days, or 4 days, or 5 days? So these two aspects, like how long this Vedana to be done on that day, and how many days this Vedana to be done. These are two factors that has to be decided by observing the number of days of what you call it as by observing the Samyak Lakshana. Now see, during Svedana, Sarvan Svedaha Nivade, that has to be done. Jirnannam has to be done. Snehabhyakta Sharirasya Shitehi Achadya Chakshushi Svidyamanasya Muhur Hrudayam Shitalehi Sprisheda. Charaka says, Abhyakta Shariram only Svedanam has to be done. Jirnannam, food has to be digested during the Snehapana, and it has to be done in a Nivada format. And after Svedana, Shanaihi Mriditaha. Immediately you just go for a massage so that body is normalized after the stimulation. And then Sneha Vidim Bhajet. The patient has to follow Sneha, the precautions, things told in, as told in Sneha Vidhi. When we are planning about that, see very specifically, Charaka says, Samyak Svinnam. After Samyak Svinna Lakshanas. Vimruditam Snatam Ushnambubihi Shanaihi. So today he has to, every day the patient must observe Samyak Svinna Lakshanas. Only after that, the patient has to be, Svedana has to be stopped. Mardhanam has to be done, like just a massage to just subside the stimulation, and then Ushnambu Snanam has to be done. After that, Swabhyaktam, Pravartangam cha Nivada Sharanastadaha. After Snehana and after a Abhyanga and Snanam with Ushnambu, then he has to stay in a very cool, means not cool, Nivada space with eating Anivishandi Ahara. Okay, so attainment of Samyak Svinna, he says on a daily basis. Let us see what is it that. Charaka says, Shida Shula Vyuparame, Stamba Gaurava Nigrahe, Sanjate Marthave Svede, Svedanat Viratir Mataha. That means Viratihi Svedanad Mataha. You must understand Svedana has to be stopped when Sanjate Mardave, Sanjate Svede. When the body becomes soft and when there is production of Svedana. Shida Shula Viparame. When Shula Viparamatvam, Shida Viparam. They can cold feeling has reduced, pain has reduced. Stamba and Gaurava. That heaviness and stiffness is gone completely. Okay. So we must understand that on a daily basis. Now, see the next sloka. Shida Shulaksha Yesvinne Jate Anganam Cha Mardave Ashtang. Okay. So, Shida Shulakshaya. Shidakshaya must be there. Shulakshaya must be there. Spinnaha Anganam Cha Mardave. Angamardava must be there. Susruta Slokam, the third one. Sveda Sravaha. The patient must have Sveda Srava. So, on a daily basis, the Samyak Svinna Lakshana that we have to be observing the patient is Sveda Sravam. Okay. For example, I have patient A, patient B, patient C. In all the three cases, I plan to do a Potra Potla Sveda, for example. I go for Patra Pot. In patient A, after 30 minutes, the patient starts sweating a lot, which is seen in the, usually seen in the tip of the nose, on the forehead, on the axillary area. Then, we must understand his Samyak Lakshana for the day is done. The patient be after 45 or 50 minutes also, he does not have Svedana. Then, you can continue. Patient C, after 40 minutes, he starts sweating a lot. Then that is a Samyak Lakshana for the day. On the first day, he may be having Shidakshayam, Shulakshayam to an extent. Second, third day, he will be presenting with Stamba Nigraham. Fourth, fifth day, he'll be having Stamba Nigraham along with the Gaurava Nigraham. Okay, initially. So, Shidakshaya, Shulakshaya, Stamba Nigraham, Gaurava Nigraham can be rated. That is, we see in a patient and then it moves on. But Sveda Sravam, or Sanjate Mardave and Sanjate Svedana. So that is one Lakshana that we have to observe on a daily basis. So this Sveda Srava basically changes from season to season. Now see in Kerala it is very hot. Now we have started our treatment at 7. We have started to do our treatment at 7 in the morning, then complete the whole full body procedure by 11, and then again from 3 to 6 in the evening. Because during Ushna Kala you go for a Pindasveda. Just half an hour only, patients sweating like anything. They needs more water. We have to be giving. We are now giving Drakshadi Kashayam to all those after procedure. We have made it a rule in the theater basically. Okay. So that is one thing. So Sveda Sravam is one. But at the same time, when we are doing the same Patra Potla Sveda to the same patient during winter, even after 50 minutes, he may not sweat. So 50 minutes is the time for that time. For the thing that time. So why I'm telling all these things, actually in Panchakarma, there has to be no SOP. The clinician has to be observing the patient very specifically if you're running your own clinic. Of course, in a big institution or academic institution, when you have 25 to 30 faculties and many patients coming from here and there, definitely you need to have an SOP and a system that has to be running. But when it comes to the patient, then you are having your own clinic with 10 to 15 patients and you are planning for management thing. This is the best thing that you can follow, because this variation this happens. Of course, for this to happen, you have to be visiting theater, observing the patient, or at least you must be employing a doctor who will be doing or seeing these things, or at least make our therapist aware about these things. In such way, we'll not be, if we continue to do Svedana to a patient who had already started sweating, okay, definitely we'll be landing up in some or the other complications later. Okay, so that is why these Lakshanas has been specifically told. Shida Shula Viprame, Stamba Gaurava Nigrahe, Sanjate Mardave, Sanjate Svede, Svedanat Viratirmataha. Susruta Svedasravaha Vyadihanihi Laguttam. Vyadihani will not happen in a single day. There has to be Vyadihani on the third day, fourth day, or fifth day. Shita Arthitvam will be there. Mardavam Chaturasya Samyak Spinna Lakshanehe Prahuhu Etaha. That is why when we list, as I mentioned, Shidakshaya, Shulakshaya, Stamba Nigraha, Gaurava Nigraha, Mardavam, Svedasravam, Vyadihani, Shitarthitvam. This we have to be grading. That is why if I say immediately observed Lakshana, it has to be Svedasravam. Okay. Mardavatvam grade 1, 2 and all every day you could see. Shidakshayam and Shulakshayam can be seen in the first day. Okay. Stamba Nigraham, Gaurava Nigraham, the patient start feeling on the first day. Most of these Ruksha treatments, when we do, they have more of Stamba and Gaurava Nigraha in the first stage, Shula later. Because we are, of course, doing Rukshana treatment for Kapha dominant cases. When we are doing Snigdha Svedas, then we have Shida Shulakshaya first coming down and then going for Stamba Nigraha and Gaurava Nigraha. So these are clinical observations, but patients may present with, somebody had asked, how will Samyak Lakshana appear differently in patients? Samyak Lakshana appear differently with respect to seen a Amavada Rogi with all swelling and all when we go for a Drava Sveda like with Dashamula Kashayadara. They will be first having Stamba Nigraham and Gaurava Nigraham only. A chronic low back ache case, then when they come and I make her undergo a Sangara Sveda like Avikiri, Mukikiri or a Patrapotla Sveda, then she'll be having Shulakshayam first. Only then she'll be having Stamba Nigraham and Gaurava Nigraham. So this difference will be observed with respect to the Samprapti of the patient. Okay. Now, this is one more Lakshana that we always have to be observing in terms of Rukshana. Because now, since we have so much of Santarpanottha-janya Vyadis when compared to Apatarpanottha-janya Vyadis, we also in our clinical practice with respect to external therapies make them undergo Rukshana therapy like Churna Pindaspeda, like Dhanyamla Dhara, like Dhanyamla Dashmula Kashadhara, like Kola Gulathadi, Sankara Sveda kind of things. So there also the Samyak Langana Lakshanas are told to be the same as Samyak Rukshana Lakshana in Ashtanga Hridaya. And see how beautifully it has been explained. Vimalendriyata, Sargo Malana. Mala has to be Sarga in a normal way, that he has to pass motion, urine, sweat, etc. Lagavatvam, Ruchi must be there. And next one is very important Lakshana called Kshutta Tritta Saha Udayaha. If the patient has got thrit but no kshutta, that means there is kleda dushti pathology like in diabetes. But if kshutta and thrit happens together, like feeling of hunger as well as the feeling of thirst is happening in a similar way or together, then that is the ideal samyak rukshana lakshana. The kleda dushti that is there in the body has been corrected with our therapy. It has been told that is shuddha thrit saha udayaha. Shuddha Hridayodgara Kanthata. Shuddha Kanthata, Shuddha Hridaya, and Shuddha Udgarata. So these are the things. Then of course Vyadi Mardavam, Utsaha, Tandra, Nasha will be there. So when I make somebody undergo a Dhanyamla Dhara or a Churna Pindaspeda, which is Rukshana and Langana in the background, then I must see this Shuddha Hridayodgara Kantata along with Chut Trit Saha Udayaha, which has to be always there in the part. So this we have to be observing. Now, the moment the patient moves from the normal Sveda to the Atispeda spectrum, it is Pittasra Gopatrin Murcha Swaranga Sadhana Brahma Sandhi Peda Jvara Shavarakta Mandala Darshanam Sveda Ati Yogaha. Patient may present with skin lesions. They may have, during when the process is going, they may feel giddiness. They may feel like burning sensation in the eyes. They may have Sandhi Peda. All these things, if a patient presents after a Sveda, then you must always have an idea or understanding that he is actually presenting with a Atisveda Lakshana, either in terms of the heat that we are giving, either in terms of time of the procedure that we are giving, or either in terms of the medicine that we are using or the pressure that we are applying in the body. These have to be regulated so that Atisveda does not happen in the patient. Okay, so that is very important. Okay. That is why, with respect to Svedana, the specific guideline has been given in all the three Samhitas. Vyadi Vyadita Desha Rituvalshan Madhyavaravaram. The Sveda has to be Madhyama or Avara or Pravara, depending upon the Vyadita, not only Vyadi and Vyadita, but also Desha and Rutu. I still remember when patients who are coming from Russia, they are very strong. People from Spain and all, of course, I cannot, it's a statistically, I may not be able to say. People who are like coming from European countries, they are more sensitive. Like Spain and all, I had a female who's just getting exposed to a big wind that happens into our theater from eastern side. She just fainted. At the same time, Russians, when we do Patra Potla Speda for 50 minutes and all, they will not sweat at all. With very sturdy body. So this Desha is important also, along with the Rutus factor that I mentioned. So these have to be considered when we are doing a Sveda to the patient only. Then we'll be having a proper Samyak Spinna Lakshana in the background. Okay. And Ayoga of Svedana, it has been told, Vatasya Apragunatvam, Gurutvam, Stabdagatrata. That Gurutvam will be there, Lagutvam will not be there. Mandaha spinnena cha glanihi trishnadinam cha vibramaha. Usually, after the procedure of when we are going to the rounds, you feel lightness in the body, no? We always have to be asking for any procedure. Laguttam indicates, our Vata and Pitta is in the normal state and Kapha is under control of Vata after any procedure. So after any procedure, if they feel illa doctor, today I feel very heavy. I feel that that means our procedure is not on the right way. This understanding we must have. Okay. Yeah. Now let us go to the last content, Vamana and Virechana. See, for Vamana, actually what is more important? Piktandam is important. Okay. So as when we are giving Shodhana for Vamana and Virechana, 4 criteria Acharya has told, as you all know: Antiki, Vaigiki, Maniki, and Laingiki. Okay. Among Antiki, Vaigiki, Maniki, and Laingiki is the most important thing that he says. But of course, Antiki is very important. Vamana, for Vamana, Antiki is Pittantam. You could see how this Vamana patient is having Pitta in the Anta of this Vamana. For Virechana, what is Antiki? Kaphantam is the Antiki. Sphatika Sannibam Kapham, it has been told. The mucosal content has to be like white in color and all. So that is Kaphantam. So Antiki is one factor. So Charakacharya in Upakalpani Madhyayam says, Samyak Prayoga Nimittahi Sarvakarmanam Siddhihi. All karma siddhi happens only when Samyak Prayoga is done. Prayoga is done in a Samyak format, only then all karma siddhi will be happening. So that Samyak Prayogam, preparatory procedure of Rukshana, Abhyantara Snehana, Bahya Sneha, Sveda for Vamana, and then followed by Samyak Snigdha Lakshanas, Sarvanga, Abhyanga, Bashpa, Sveda, Kafot, Klesha, Ahara. All these have to be done in a proper way for Samyak Vamana Lakshana. Digestion of previous day's food, good sleep and bowel, time of procedure to be Kabakala, and then we give Ishat Snigdha Peya for Vamana, because if we don't give that Peya in the morning before Vamana, the tendency of the patient having going for Virechana will be more. That is why this little Ishat Snigdha Peya has to be given just before Vamana. After Akhantapanam, the Vamana Aushada's dosage and all is very specific. Only when the proper dosage of Vamana Aushada is given in that context, we will be able to observe the Lakshana of Samyak Lakshanas. Now, practically, let us see how can we assess this Samyak Lakshana in the background. Now, you could see Pittandam there, whether it is Pitta or not, by seeing we could see, and there is something called as sulfur. Many a times when you are using ST fandom, especially in the patients, we will not be able to have this ST, I mean, yeah, yellowish color because ST is almost greenish yellow, and this only when milk is given and the patient gets pittam, we'll be able to identify. In ST, pittam may not be identifiable if ST comes, I mean, we start giving ST. There, one Lakshana that we see for the patient is Tiktasyada. So even the patient, when we start giving in Vasantika Vamana, when we start giving fandam, ST fandam only we use for Vasantika Vamana. We start giving ST fandam, and then after we go continue and the patient vomit and we give Vama, then continues vomiting, this happens. And after some time, what happens, the patient starts saying ki, doctor, I don't feel any taste in the mouth. So that means, it is an indicator for me that I can stop the procedure, because further he may feel Tiktaseda. In Yashti Fandam Vamanas, we may not see Pittam generally. And sometimes some patients do say ki I have this Tiktaseda much now. That means even though we don't see Pittam in the container, Tiktaseda indicates there is Pittam, we are unable to identify it. So Antiki, Tiktaseda or Pittandam is one factor. Vegiki, of course, number of Vegas. And then Maniki, we of course have to be in Vamana, we go for Maniki. In Virechna, we don't go for, we will not be able to do. No, in both the cases, Samyak Laingiki Lakshana is very important. Nirvibandham pravartante kapha pitta anilaha kramat. So Nirvibandham pravartante kapha pitta anilaha kramat. Kapha first initially comes out, pitta comes up, and then once this after pitta comes, once when the patient has this udgara kind of things coming up, then vayu had started coming up, then we should not be giving further medication. It indicates this is the end of the process. That is how we assess the antiki of vamana. Okay. Yeah. So that is why identification of Pittandam Vamanam, Pratyaksham and Anumanam. Anumanam is Taksha, as I mentioned, Tiktasyata. And you could see how you could see in a case, after Vamana, the patient, everything was open. The patient was like sent, and then while the patient was going, he again started having bout, and we could see only Pittam at the end. I mean, so we had a plate there, and then just we held the Pittam there, and this much was that. Only Pitta came out in that case. Here you could see how Pittam has come up. Yeah, this is another Pittanda Vamanam. This is the Vasandika Vamanam that we had done. We use only HT Fandam there, as I mentioned. Tiktasita is seen. Now to the last area, Virechanam. In Virechana, Shleshma Kale Gade Jnatva is the time of administration. Shleshma Kala means Shleshma Kala at the end of the Kala, the atmospheric Shleshma also, as well as the end of patient's Shleshma Kala. That means the Shleshma Kala of the Kala may be from sunrise to next 2 to 3 hours. But the patient feels appetite means that means its Pitta Kala has started. So we have to be giving medications in a way that before he feels appetite, that has to be given. Because time of administration of Virechana Dravya is very important for its pravartanam in a samyak way. Otherwise, the medicine may get digested or the patient may vomit. These two things happen. If the patient vomits after Virechana, medicine given, and then he has vomiting, it indicates there is kaba in the background and you have not given the medicine in the right time as such. That is why the Shleshma Kala, you may have to identify there, we have to be observing the routine of the patient and also in terms of season. Okay. Okay. So as I mentioned, the appetite during the medicine administration should not be much, should not be much. There should be no appetite at all. Pittotlesha Ahare has to be done on the previous day. On the day of Virejna Aushad also, Abhyangushma Svedam has to be done. After giving the medications, the amount of water intake has to be restricted. All these things I'm telling because to observe the Samyak Lakshana, number of Vegas and content of Vegas has to be observed. So how will we assess the number of Vegas and content of the Vegas? As I mentioned, Antiki, Maniki, Langiki, Vegiki. Maniki in Virechna, we never do that. Antiki, as I mentioned, it is mucus. Kapantam has to be done. So we ask the patient, so you must feel that some sticky thing is coming out. You just to feel that is one thing. And in Vegas, that is Vaigiki, the patient may go to toilet, may have 10 sittings. Like he goes to the toilet, we say it as one sitting. In one sitting, he may have 2 to 3 Vegas. Okay, so that we advise them to just note. Okay, so in one sitting again, he may have 2 Vegas. So second sitting, 2 Vegas. Next sitting, he will have only 1 Vega. So 1 Vega. So we don't calculate Vegas by 7 times or 8 times. We calculate Vega with respect to the so-called number of sittings with each Vega. So he may have 2 days patient had 7 sittings but 14, 15 Vegas. Okay. So that is number of Vegas. Now then when we think about, the Langiki of Virechana Yoga, Shroto Vishuddhihi, Indriya Samprasadaha, Laghutvam Urja Agnihi Anamayatum, Praptista Vitpitta Kafanilanam, Samyak Viriktasya Pravetkamenaha. Shroto Vishuddhihi. How to assess Shroto Vishuddhi? That is a subjective thing only. Okay, the patient will have any kind of Shrotas, he says. So if you are going for a Virechana and Shwasa Rogi, Pranavaha Shroto Vishuddhi must be there. If you are going for a Virechana in a Vadrakta Rogi, his which Shrotas will be there, his Asti and Majja Shrotas must be corrected. That means his pain has to come down. If we are going for a Virechna in a Prameha Rogi, which Shrotas his Mamsa and Medavaha Shrota Vishuddhi must be observed, right? So that is why the Shrota Vishuddhi is a broad term with Samprapti we have to be assessed. Indriya Samprasada, all Karmendriya, Jnanendriyas you have to assess. Next is important Laghutvam Urja. After Virechna, you are feeling Laghutvam and Urja, energetic. Agnihi has to be good and Anamayatam, disease comes down. And then, the order. Vit Pitta Kapha Nilana. Vit first goes Pitta. There in Ashtang, Vamana it is Nirvibandham Pravartinte. Kapha Pitta Anilanam. Kapha Pitta Anila. No Vit is there. Here, since it is through rectum, Vitta Pitta Kapha Anilanam. So, Kapha Pitta Anilanam, here it is Pitta Kapha Anilanam. There is a change in the order. See, we say Virechanam is for Pitta, but Antikyo Virechanam is Kabhandam. Vamana is for Kaba, but Antikyo Vamana is Pittandam. That is why both Vamana and Virechana are for Kapha Pitta. Vamana is for Pitta Kaba, Kaba Pitta, and Virechana is for Pitta Kapha. That has to be our understanding. So these, generally after Virechana, we observe Lagutvam and Urja. And that order we say whether mucus has come out kind of things that we ask. Sota Vishuddhi and all, as I mentioned, according to Samprapti only we will be assessing. And then, there, as I mentioned, any Samyak Snigdha Lakshana, there are Lakshanas that we have to be observing immediately. For Vasti and all, there are some Lakshanas which we will be discussing in the next session. Vasti, Nasyam and Murtha Dailam, we have kept it as a Murtha Prayogas. With these three, we have kept it as another session because it needs again a more serious kind of observation and discussion. So there also, as I mentioned, on the day of Virechana, what we observe and over a period next and next day, what is to be observed. That is why we keep patients who have undergone Vamana and Virechana with Peyadikrama. Okay. And some Ashtanga Susruta Samyak Virechana Lakshana Gateshu Dosheshu Kafanviteshu नाभ्यां लघुत्वे मनसश्च तुष्टौ गते अनिले चापि अनिलोमभावः सम्यक् विरिक्तं मनजं व्यवस्येत्. So नाभ्यां लघुत्वम is there, manat tushti is there, kafandimiteshu dosheshu, like kapha has to go at the end. Gate anile acha api aniloma bhavam, anilam has to be in the aniloma bhava. That way only Samyak Virikta Manuja has to be considered. Okay, fine. So the Lakshanas include Shrota Vishuddhi, Indriya Prasadam, Diktagni, feces, Pitta, Kapha, and Vata are expelled in a succession. And in Ayoga, generally, I have seen patients developing skin issues and penism. Pratisham, Syad Shleshma Pitta Anila Samprakopaha, Sadas Tadaha Agne Gurute Pratisha, Tandrats Tada Aroja Kasta, it has been told, and Vatanuloma will not be there in the case. So generally, patient will be feeling heaviness, then Agrimandi will be there, some kind of, after Virechana, if this body may swollen up if nothing goes out as such, if there is something remaining. This Utkleshanam happens in the body. Okay, Utkleshanam happens in the body. And then we are, with this Vedana, we are bringing the dosham to the koshtam. And this dosha Utkleshana in the shaka, if it has happened properly, but in the koshtam it has not properly come, then we give Virejna Aushada, but at the same time what happens, Virejna Aushada with respect to its dosage and all, it has not come out to be proper in terms of its response and all. Then again, what we say, there will be Ayoga in the background and there can be other Vyapat that may follow. That is why in Siddhasana, this 15 Shodhana Vyapat has been 10 Shodhana Vyapat has been told. Very Spadmana Parikartascha, Hridgatrayo, Jivadanam, Savibramsham. Okay, so all these things, Samba, Sopadravo, Klamaha, these are all, multiple Vyabat that can happen because of issue at the level of dosage of medication, costum of the patient, Agni, and other circumstances. Okay, fine. Atiyoga Virojana has one concern, probably hyponatremia. That reduction of electrolytes is the common thing that we observe in Atiyoga. Pitta Kapha Padeshu Nisrudeshu Kramatstravan. Generally, we have not seen, whenever I discuss Panchakarma specialists from Karnataka, Maharashtra and all, many of them have communicated about, complications of Virechana not getting stopped and then they have to be put on IV and all. But generally, we don't observe Virechana issues much. Okay. But the content of the liquid, if it is very smelly and the patient, sunken face happens and all in the case, in such cases only, yeah, I think I'm. So in sunken face happens if we continue Virechana and all. Then you see the Lakshanas of dehydration. Then we have to be careful. Okay, generally what we give is during Virechana, if the patient feels any kind of tiredness and all, we ask them to have draksha. So that will be helping them to, that rasakshayam will be stopped in a background. Okay. Yeah. Yeah. So I think my conclusion of today's session would be, see, proper execution of Purva Karma, Pradhana Karma, Paschat Karma in terms of dosage of the medication, considering the Agni of the and Koshta of the patient, considering the time of administration with respect to the whole Samprapti has to be our target. If we are doing all these things, Samyak Lakshana has to be the things that help us to assess whether what we are doing is in a correct way or not. So whatever, whenever you apply any procedure in terms of Sneha, Sveda, Vamana, Virejana, Vasti, Nasya, etc. on the patient, always try to observe these Samyak Lakshanas, which are actually our golden guidelines, which gives us an idea about whether we are doing it right or wrong. Oh, okay, so I think I conclude my session by this slide. Open for discussion or any questions. Yeah.
Thank you, ma'am, for the wonderful session. As I have shown at the starting, there is a course related to this professional diploma in Panchakarma. So if you are interested, if anyone of you are interested in that course, you can contact Ayurvedamap. And we have some queries in the chat box, ma'am. Shall we discuss that?
Sure. Yeah.
Okay. How to decide it as Pragbhakta Madhyama in cases? One doctor has regarding the ghee, Snehapan, I think, ma'am.
Pragbhakta Madhyama means that's why what is the sloga? Prang Madhya Ado Bhakto Asau Ado Madhya Urdo Dehajan Jayet. That is the sloka, no? If we give Pragbhakta Snehana, Adho Gata Rogas gets corrected. If we are giving Madhya Bhakta Snehana, Madhyama Rogas gets corrected. If we give Adho Bhakta Sneha, Urdhva Roga gets corrected. That is why in that ulcer and stenosis case, I had given Snehapana, since the issue is in the Nabi area, Madhyama, I had given Snehana in between the food, Madhyamakta. Okay. In that, what you call it as, in the paraplegia case, when he gave us Prag Bhakta, just before food, he improved. Okay. In the same way, if somebody has got the eye issue, continuous penasam and all, then we go for Trifalagridam at night after food, Adho Bhakta. Okay, so that affinity of ghee when it is taken along with food before or after has got a special affinity towards the samprapti. That is what I wanted to say.
Okay, ma'am. Thank you. Dr. Ananya has asked, can plain cow ghee be given for Snehapana or Samskrita Grida has to be given? Is it compulsory to give Samskrita Grida?
Yeah, that's always a point of discussion and a thing among us. Actually, this plain grida and Shodhananga Snehapana. I mean, plain grida versus medicated grida. Medicated grida has got a special affinity towards dosha dosha samurchana. For example, if I go for tiktaka gridam, it will have a special affinity towards pahiroga marga. If I'm planning for a Dadimadi Gridam, it has got a special affinity towards the Madhyama Roga, Koshtam, Abhyantara Roga Marga. Plain Grida does not have any affinity towards any point as such. So, that doesn't mean that plain Grida cannot bring in Utkleshna in the body. Plain Grida definitely can bring in Utkleshna in the body. So, there has been studies, I think more than 10 studies wherein plain Grida was observed with respect to medicated Grida. Study says both Samyak Lakshana in plain grida as well as this thing has been almost similar, but in kushta cases medicated grida has given there was no skin issues getting worsened with medicated grida, but with the plain grida it was observed and all. So in general cases, if you feel the dosha dushti can be managed with the plain grida with no special affinity towards a samprapti, plain grida can be an option. But I feel when there is a special samprapti, the medicated grida which has got a special affinity towards a samprapti will be better.
Okay, ma'am. Thank you for the answer. Next, Dr. Kartika has asked, ma'am, if we plan Shodhana Chikitsa in chronic diabetic patients on allopathic medicines, like with controlled sugar levels, should we stop their oral hypoglycemic medication during Snehapana? Please explain.
You can regulate it basically. Okay, so see, in the case that I had told later, he was on dapagliflozin and glimepiride, 1B, dapagliflozin 1 and glimepiride 1BD. I had given him Parukshana before Snehapana as Udvartana. His blood sugar has reduced. So I had reduced the medicine of glimepiride to 1 OD and dapagliflozin. So it's not a good idea to completely withdraw it according to the response, because just before to Snehapana, I had seen the blood sugar again. So it was fasting was 94 and PP was only 124. So I'd reduce the medication. So with Rukshana, you can see how he is responding and you can regulate the medication. If the blood sugars are not under control, then already allopathic medications they are having, we need not regulate it at all. See, once the patient is on allopathic medication for more than 2 years, completely replacing or stopping allopathic medications with then giving our medications, the body won't respond. That is my clinical observation. If within 6 months we'll be able to like manipulate, we can stop and start. More than 1 to 2 years of allopathic medications, it is very difficult to suddenly reduce it. We have to give our medication, see how the patient is observing for us 6 to 9 months and all. Then we'll be able to taper it, and then reduce it. That will be the best methodology. So you can regulate it. If the sugar is not under control, better not to stop it. If he's already on allopathic medications, if he's not started it, then we can confidently go on with our medications. It will reduce, Shodhana and all will reduce the sugar. Yeah.
Okay, ma'am. Thank you.
So,
Next question. Madam,
Yeah.
what could be the reason for no stoppage of vomitings after Vamana Karma, not as Vegas, but very small bouts of vomitings 3 to 4 hours after Vamana Karma until afternoon? Pittanta was seen, no vomitings for 3 hours after Vamana Karma. Later, vomiting started. In that patient, Saindava Jala was also given after Yashti Panda, and almost all of Saindava Jala was vomited out during Vamana only.
I think I did not understand the case.
Yes.
Yeah. I mean, what had happened? Can doctor just unmute and explain what had happened actually?
Okay. Dr. Virajita, can you unmute and speak? The question was
Hello,
not
ma'am.
clear.
Yeah, Dr. Virajita. Yeah.
Ma'am, actually, patient had 8 Vegas for Vamana Karma.
What did you give for
Vamana,
Vamanam? What did you give for Vamanam?
classical medicine, ma'am. Madanapala people.
Okay. After Akantam milk, right?
Yes, after Akantam milk, Vamana medicine was given. Then Yeshti Fanta and then Saindava Jala. With 8 Vegas, the Vamana was completed.
After
Dhumapana.
when did you when you gave how much of tell me the order you give milk and then when did she start having the bout immediately after milk or with ST how was it?
Not immediately after milk. After almost 1.5 liters of milk, a Vega kind of thing was seen. Then Vamana Aushadha was given, madam.
Before Vamana Aushadha giving only patient had Vega kind of thing with
Yeah,
milk.
yes, with one Vega. So we thought it could
Okay.
be Utklesha.
Okay, fine. Then
Then Vamana Aushadha was given. After 25 minutes after giving Vamana Aushadha, patient started having Vegas.
so you after giving Vamana Aushadha again you did not give further medication you just waited.
No, only one single dose was decided and it was given as Vamana Aushadha.
Okay, fine.
After 25 minutes, she started having Vegas. She had almost 4 Vegas. Then Yeshti Fanta was started. Yeshti Fanta only like 500 ml was given because patient was she started again vomiting. Started having Vegas again. So that 500 ml it came out in almost 2 Vegas.
Then
Then Saindava Jala was given, madam.
uh,
Saindava Jala alone, mixed lightly with Yeshti Fanta and very little milk, it came out as Vegas again. 2 Vegas, that's it.
okay, then
Then we observed for another 20 minutes. She did not have any Vegas and she felt very light. So we went with Dhumapana.
okay, then
After that,
what?
after she went home, she did not sleep also. If she had some thirst, we advised her to take water. 3 hours after Vamanam, after she went home, that is after she went home, she started having vomitings. Just plain like watery like vomitings. It happened for
Pitta.
around 6 to 8 times.
What was the content? So she was not under your observation. She was sent to home.
Yes, she was sent home because it was run on OPD basis.
Okay. So after going after 3 hours, she started having this thing. What was the content? Was it pitta or liquid?
She mentioned yellowish coloration of vomitus, but not as yellow as Yashti Fanta or that color. Very light yellowish color.
Yeah, so that's possible, Virajita, because see, you have not stopped Vamanam after Pittantam, right?
Hmm. Okay.
Okay, yeah. So Pittantam is the Antiki. Okay, so you just waited. Probably means there was Utklesham in the body, and the body wanted to have Pittam. with the medications, after, as you mentioned, with milk only she vomited, but after my medicine you gave, you had waited for 20 to 25 minutes, and then she started having 3 to 4 Vegas. Okay.
Yes, madam.
Then during that time, if you would have given again milk continuously, probably the pittam that was triggered during that time, that might have come out.
Okay, madam. Okay.
Okay, so that was not given, because why milk is given? Milk is given for facilitating the pittam to come out actually.
Okay.
Okay, so in generally, of course, roga biru roganurodadaha. If that was given more milk in that on, then probably that could have happened. But then that did not happen. So there was pitta started, but the vehicle to come out was not there. Okay.
Okay.
That was one factor. And then I feel Yashti Fanda's dosage, probably, Yashti Fanda, when you make the quality of Yashti that we have seen, quality of Yashti. Yashti Fandam, Yashti is something that can cause Virechna, that can cause Vamana. That is one good, it is in Asthavana Yoga also. So Yashti, when it is in lesser dose, it will not be inducing Vamana. So if your Yashti Fanda's concentration was lesser, it may not be again supporting the whole output of Vamana Antiki as Pitta. So that is was also there in the body. So ultimately at the end, whatever body has to throw out, it was not completely happening during the procedure. But over a period, body has to throw out. I think her condition was kapha plus plus. So naturally, when the Pitta Kala
Yes.
happened, like probably, yeah, so probably when morning you had done Vamana and send her home, by 2 to 3 hours, when Pitta Kala has happened, the Vamana Dravya was already there in the background. It's not completely come out. So Pitta Pravartana might have happened. So that's there, because almost when we send the patient to home, no, I mean home alla, we generally don't send the patient to home immediately after Vamana. We at least keep the patient till afternoon. Even if it is OPD level, we will be observing the patient till afternoon. Okay, because
Okay.
after going also, this bout of thing can happen. Next to 4, 5, 6 hours, till then it can. So we always advise them, you must take rest, should not walk, etc. Have only little hot water. If you feel hunger, have payat, keep a bucket aside, because you may feel again vomits. There is possibility of vamana, and there are possibility after going back. As I told, no, I had shown a picture of plate with yellow, I mean, bile there.
Yes, ma'am. Yes, yes.
Everything we had finished off and the patient was going, then she had this vagam coming up. She felt, doctor, some pain, chest pain, something is coming up, some abdominal pain, and suddenly there was a plate, and then we had that, and that had come up. Okay, so that
Okay.
pravartana will always be there.
Okay,
Okay,
ma'am.
yeah.
Thank you,
Okay,
ma'am.
thank you, doctor, and thank you, Virajita, for asking that. And in our regular classes of our Panchakarma course, we'll be discussing much more relevant topics in very detailed way. So if you are interested, you can contact Ayurvedamap. And I think we have done with our questions. And if you don't have any other questions, you can post your feedbacks regarding the session. Okay.
I think Dr. Tabassum had asked about what should be done if Virechna is not done properly. The patient got only 1 week after taking Virechna medicine. Yeah, so that means next day you have to be observing why she did not have. You have to go for the medicine on the next day. Okay, so probably you would have given the medicine when the patient is feeling appetite. Okay, so when he's having hungry, and then when the patient has got appetite, then you might have given the medication. Okay, so that could be the reason, that could be the possible thing. Okay, so the medicine might have digested and gone. Okay. So next day, observing what could be the reason, you have to go for Virechna with another medicine, not the same thing. If you have given with Erandadilam, you must follow a Churna on the next day. And if you could see proper Snehana is not there, it is because of Adrida Koshta and all. You could see the context there in the Ashtanga Hridayam as well as Charaka says, then you have to make him undergo again Vamana, again Snehapana, then Virechna. That is the way that has to be done. Hope I'm sure. Yeah.
Ma'am, Dr. Kartika has asked, ma'am, will avapid Snehapana help in patients with chronic kidney disease, not on
You have
dialysis?
to, yeah, yeah. CKD, yeah, it's not a I think because in CKD there will be severe Agrimandya. When Agrimandya is there, Snehapanam is not a choice. So we don't practice CKD. But there is a possibility observing if there is a digestion. I mean, Agni things can happen and all. I mean, Agni can be stimulated. You can go, but generally there will be Agni Mandhyam, lipid metabolism will be very low. In CKD, we don't go for Snehapana.
Okay, doctor. Thank you so much. Santoshi has asked whether medicated Grida is Vicharna Sneha or okay. Is it Acha Sneha? It is Vicharna Sneha, ma'am.
Whether it is medicated ghee is an Achasneha when you give ghee only internally to the patient. When it is ghee, but Tiktaka is Achasneha. You mix Tiktaka with Peya or something else, it becomes Vicharana. Otherwise, medicated ghees are Achasneha only. Sneha that is processed with medication, but ultimately it is Sneha only, no? So it is
Yes.
Achasneha only, yeah.
I hope the answer is clear, Santoshi. Next, Dr. Kartika has posted, thank you, ma'am, for such an insightful session. Dr. Tabassum, Snehabana, Sarvanka, Abhyanga, and Swedana is done properly, ma'am, but Virejana is not done properly. It's been a week. Can I suggest to continue Virejana now with Trivrit Lehya?
You can plan for that, but again, if it is 1 week, again, you have to go for a Snehanam. Like not the classical one, maybe 1 or 2 days of Peya or something with Vicharna kind of Snehana, then you can make her undergo. Because if you have done a high dose Snehapana and then not made her undergo proper Virejna, that will cause further complications. You must do Virejna in her. So you can repeat Virejna, no issues. If you have done with Erendadailam, if his Madhyama Koshta, plan for Churnam, if that is nothing. Erendadailam only one vega, Trivirthilehiam is much milder than Erendadailam. Okay. So that may not be a good choice. So Churnam Sveda, Churna things like Vidanga Danduladi or Avipati or Icha Bedi Rasa can be a choice. Hope I'm clear, Tabassa. Yeah.
Okay, doctors, thank you for the queries and feedbacks. Okay, ma'am. If there are no relevant questions further, shall we wind up, ma'am?
Sure. Okay. Thank you all. Wishing you a very successful practice in future. Okay. Bye. Namaste.
Okay, thank you, doctor. Thank you, all the participants. Good night.